Gentlemen, let's talk candidly about something that changes for every man past the age of 50. It's the elephant in the room that no one wants to discuss openly, but everyone wonders about privately. Potency, stamina, and that certain confidence that comes with knowing your body will simply respond when you need it to. You might have noticed the process is slower now. Maybe the firmness isn't what it used to be. Perhaps you're experiencing unexpected urinary issues, or that nagging, chronic lower back pain has worsened. And like most men, you've probably accepted this as the inevitable price of getting older. But what if I told you that the decline you're experiencing isn't a life sentence written in stone by Father Time? What if the real culprit wasn't your age, but a simple mechanical bottleneck in your core anatomy that you've unknowingly neglected for decades? I'm talking about a specific, powerful pressure point on your body, a therapeutic nexus that when activated for just 60 seconds a day, can fundamentally clear that bottleneck and reset your system. What if there was a simple, private act of self-care that could dramatically improve the arterial blood flow to your entire pelvic region, ensuring the spongy tissue responsible for firmness gets the volume it needs? Decompress the critical nerves that govern sensation and response, leading to a noticeable return of youthful sensitivity? Release deep, chronic tension in your core muscles, alleviating stiffness not just in the bedroom, but in your lower back and hips? I know, it sounds almost too simple to be true. You might be skeptical, thinking this is another bizarre, new age health fad. Please, hear me out. This specific spot, which we are going to locate together in detail, has been revered in traditional medicine systems for thousands of years as the meeting of yin, the epicenter of male vitality. And today, modern urology and physical therapy are finally providing the anatomical evidence for why this technique is so profoundly effective. I'm going to guide you through a complete, step-by-step protocol. I will show you the exact location of this powerful spot, sometimes called the $1 million point. The precise 60-second massage technique that yields maximum circulatory and neurological benefit. The best natural oils that turn this simple massage into a deep, therapeutic treatment for inflammation and vascular health. This isn't about popping a pill, it's about taking command of your own physical destiny. It requires no expensive equipment, no awkward doctor visits, and just 1 minute of your time. This simple practice could be the missing piece in your health routine that restores your comfort, freedom, and confidence. So, before we dive into the deep anatomical truths, I have a quick request. If you are committed to finding natural, proactive solutions to better health, hit that like button right now. It helps this crucial information bypass the usual noise and reach more men who need it. And drop a comment below. Tell me, what's the single biggest misconception about male aging you want to dispel? Let's start the conversation and build a community. Let's be honest about the conversation men have, or more accurately, don't have about performance after 50. The cultural narrative is powerful and discouraging. Things slow down, things get weaker, and eventually you just accept it. Maybe you rely on a prescription as a quick fix, an emergency measure when you need it most. That acceptance is the biggest mistake we can make. It's the surrender that kills confidence long before the biology does. I'm here to tell you that the decline is almost never a switch that's been flipped by your 50th birthday. It's a slow-motion catastrophe, a mechanical and circulatory chokehold that builds up over years of modern living. Your problem isn't a sudden failure, it's a traffic jam at the most critical intersection in your body. When a man experiences a significant decline in erectile quality, consistency, or sensation, the root cause is a convergence of 3 mechanical issues, all centering on the very spot we are about to massage. Understanding these 3 points is key to believing in the power of this 1-minute fix. 1. The vascular culprit. Arterial stagnation and stiffness. Biologically explained, the rusty plumbing analogy. Think of an erection as 90% blood flow. The penile tissue is like a sponge that must rapidly fill with blood, and that blood is delivered by the internal pudendal arteries. These arteries run straight through the pelvis. Years of Western diet, inflammation, high stress, and most critically, sitting for long periods cause the inner lining of these vessels, the endothelium, to stiffen. They become less flexible and less responsive to the signals that tell them to dilate. Practically, when you're constantly sitting, gravity and pressure compress these vessels. This slows the flow, leading to stagnant blood. blood that's lower in oxygen and higher in metabolic waste. It's like having rusty plumbing. The water pressure is low and the water quality is poor. Emotionally, this leads to a loss of spontaneity. The system takes longer to prime because the flow isn't instant. This delay creates anxiety, which further constricts blood vessels, creating a vicious cycle of performance panic. 2. The muscular culprit, the pelvic floor chokehold, hypertonicity. Biologically explained, the chronic tension paradox. The pelvic floor muscles, PFMs, are a diamond-shaped sling of muscles controlling everything below the belt, bladder, bowel, and sexual function. The paradox of the modern man is that his PFMs are often tight and weak at the same time. They are constantly tensed, hypertonic, due to stress, posture, and clenching, but they lack the endurance or strength for proper function. Practically, imagine holding a rubber band stretched tight for 24 hours a day. It's tight, but it has no snap left. This chronic tension is physically squeezing the major blood vessels and nerves that run through the pelvic region. It's literally choking off the supply line just as the signal arrives. Emotionally, this is a source of subtle, constant discomfort and tension. It reduces your body's ability to enter the rest and digest, parasympathetic state, which is the necessary physiological foundation for sexual arousal. You can't be stressed, clenched, and erect simultaneously. 3. The neurological culprit, faulty wiring and compression. Biologically explained, the garbled signal. The pudendal nerve is the superhighway for sensation and the go signal for the erectile tissues. This nerve, which originates in the lower spine, runs right through the muscular structures of the pelvic floor. When the muscles are hypertonic tight, they often pinch, compress, or irritate this crucial nerve. Practically, think of a compressed nerve as faulty wiring. The signal gets garbled, slow, or weak. The result is a dulling of sensation and a delayed or incomplete physical response. Emotionally, loss of sensitivity is often the first, most subtle sign of decline, but it's devastating to confidence. You feel disconnected from your own body, making it harder to feel the signals and harder to fully engage in intimate moments. The bottom line, your vitality is not gone. It is trapped behind this mechanical bottleneck of stiff arteries, tight muscles, and compressed nerves. The spot we are about to target is the release valve for all 3 of these systems simultaneously. That is the power of the 1-minute massage. Before we get to the how, let me properly introduce myself and share my philosophy. My name is Dr. Narita, and for the past 12 years, my practice in urology hasn't just been about surgery and prescriptions. It has been about finding foundational, holistic, and sustainable ways for men to maintain their total health, physical, sexual, and emotional. I've had thousands of men sit across from me, often feeling frustrated and isolated, telling me, "Doctor, I don't feel like myself anymore." They are tired of the quick fix approach that doesn't address the underlying issue. They are tired of feeling like a collection of broken parts. My guiding philosophy is this: you are not a broken machine. You are a magnificent system that needs proper, consistent maintenance. The decline you're fighting isn't a mystery. It's an anatomical issue that requires an anatomical solution. My work has led me to study deeply the principles of Eastern medicine and physical therapy because they recognize what Western medicine often forgets. The body works as a single, interconnected unit. The tightness in your hip flexors affects your lower back, and the tension in your lower back directly affects your pelvic floor, and yes, your potency. This massage technique is not something I invented. It's an ancient wisdom now validated by modern physiology. I recommend it to my patients not as a replacement for comprehensive care, but as a cornerstone of daily preventative maintenance. It's about empowering you to be the co-pilot of your own health journey. We are moving away from passive dependency, waiting for a problem to happen, and relying on a pill to patch it, to proactive mastery, using simple daily actions to prevent the problem in the first place. It's about investing 1 minute a day to ensure decades of future comfort and confidence. So, let's locate this crucial command center and learn how to use it. We've established the why, the mechanical bottlenecks of circulation, tension, and nerve compression. Now for the how, the execution. But before I show you the exact location and technique, we must address the 5 biggest mistakes men make when trying self-care practices like this. Avoiding these pitfalls is the difference between quitting after 3 days and seeing life-changing results after 3 weeks. Mistake 1. Aggression over finesse. Too much, too hard, too soon. The error. Treating this delicate area like a deep tissue sports massage on a hamstring, men are conditioned to think more pressure equals more results. Biologically explained, the perineal area is an intersection of delicate nerves and highly vascularized tissue. Aggressive, deep pressure doesn't break up tension. It can cause inflammation, irritate the pudendal nerve further, and create microtrauma in the tissue. This inflammation actually worsens the circulatory chokehold you are trying to fix. Practically explained, if you are sore the next day, if you feel bruised, or if you feel a radiating, unpleasant sensation, you have gone too hard. The correct pressure is the ripe tomato check, firm enough to slightly indent the tissue, but gentle enough that it feels therapeutic and slightly tender, never painful. Emotionally explained, pain leads to avoidance. If the practice is uncomfortable, your brain will label it as a chore or a punishment, and you will quit. We are aiming for a sense of relaxed, intentional self-care, not a self-inflicted medical procedure. Ease up. Consistency at a gentle pressure beats intensity every time. Mistake 2. The dry rub, ignoring the oil protocol. The error. Attempting the massage without any carrier oil or using the wrong substance like petroleum-based products or sticky lotions. Biologically explained, the oil is not merely a lubricant. It's an active, therapeutic ingredient. Dry massage creates excessive friction on the superficial skin layers, which can lead to irritation and the formation of micro tears. More importantly, it doesn't facilitate the deep tissue penetration necessary to address the root vascular issues. The right oils, like castor oil, carry powerful anti-inflammatory molecules deep beneath the surface, transforming the mechanical action into a mechanochemical treatment. Practically explained, friction. You want to glide, not rub. Dry skin prevents the deep, consistent pressure you need. Using the wrong products, like heavy mineral oils, can clog pores and counteract the natural hormone-supporting benefits of natural oils. The oil is half the prescription. Emotionally explained, a warm, therapeutic oil makes the practice feel like a ritual rather than a necessary inconvenience. It engages your sense of touch in a comforting way, which is vital for reducing the stress hormones that interfere with function. Mistake 3. The weekend warrior mentality, inconsistency. The error. Trying the massage for 3 or 4 days, seeing only minor changes, and quitting because you didn't get a miraculous result. Biologically explained, we are trying to retrain decades of stagnation and chronic muscular clenching. You don't get fit after one workout, and you don't clear a traffic jam with one pass of a traffic cop. The body responds to consistency. It takes time for the arterial walls to regain elasticity, for the metabolic waste to be fully flushed, and for the nervous system to feel safe enough to truly relax the pelvic floor muscles. Practically explained, expect initial improvements in sensation and relaxation within 7 to 10 days. Expect significant, measurable changes in consistency and firmness after 4 to 6 weeks. If you miss a day, don't try to make up for it by doing 10 minutes the next day. Mistake 1. Just get back on your 1-minute daily track. Emotionally explained, this mistake stems from a desire for instant gratification. This practice requires patience and self-trust. When you stick with it, the emotional reward isn't just better function, it's the profound satisfaction of knowing your body is responding to your intentional care. You are proving to yourself that your system is still repairable, still responsive. Mistake 4. Poor positioning and strain, the awkward angle. The error. Trying to perform the massage while standing awkwardly or sitting in a strained position that causes hand or wrist cramping. Biologically explained, if your core muscles are tense or you are straining to reach the area, the very muscles you are trying to relax, the hip flexors and pelvic floor, will be tensing up, effectively fighting against the massage. You cannot relax a system that is actively being strained. Practically explained, you need a comfortable, stable position that allows you to apply pressure at the correct angle without effort. I recommend 2 primary positions. Lying down. On your back, knees bent, feet flat on the floor. This completely relaxes the hips and pelvic floor, allowing deep, easy access. Edge of the chair. Sitting on the forward edge of a sturdy chair with your feet flat and knees wide, this slightly opens the area and gives you excellent leverage. Emotionally explained. Awkwardness leads to avoidance. If you are struggling to reach, the 1 minute will feel like 5, and you will eventually abandon the habit. Make it easy, make it comfortable, make it repeatable. Mistake 5. Focusing only on the event, creating performance anxiety. The error. Only doing the massage immediately before a planned intimate moment, or viewing the practice solely as a pre-game necessity. Biologically and emotionally explained, when you link the massage only to performance, you instantly add pressure, stress, and expectation. This spike in anxiety triggers the sympathetic nervous system, fight or flight, which dumps cortisol and adrenaline into your system. These hormones are potent vasoconstrictors. They literally shut down blood flow to the non-essential systems, like the erectile tissue. You end up fighting your own chemistry. The solution: frame this as daily maintenance for overall pelvic health, like brushing your teeth. Do it at a neutral time after your shower, before bed. The goal is to build a healthy, functional system 24/7, so that the response is natural and effortless when the time comes, not forced and stressful. Now that we've eliminated the common pitfalls, let's get specific. Here is the complete protocol for turning 60 seconds of focused touch into deep, systemic health. Locating the command center, the perineum. The spot is called the perineum, or in the lexicon of traditional Asian healing, the Hui Yin point, a place where the fundamental energy channels of the body converge. The anatomical guide. This area is the diamond-shaped region situated exactly halfway between the base of your scrotum and the tip of your tailbone, coccyx. You want the central, fleshy, soft tissue section right in the middle of that forward half. The tender clue: gently probe the area. You will find a point that feels slightly different, perhaps a soft indent, and when you apply moderate pressure, it will be noticeably more tender than the surrounding tissue. This tenderness is a great indicator that you found an area of chronic tension and vascular stagnation. This is your target. The why. This location is critical because it sits directly above the bulbocavernosus and ischiocavernosus muscles, the core powerhouses of the pelvic floor that are essential for rigidity and ejaculatory force. It is also the junction point where the internal pudendal artery dives into the deepest part of the pelvis to supply the penile tissue. The technique refined, your 60-second protocol. Once you have established your comfortable, relaxed position, knees bent, lying down is often best, and warmed your oil, follow this minute-long sequence. Step 1. Application, 5 seconds. Use enough warm oil, about a teaspoon, to coat the entire area. Let the warmth of the oil relax the skin surface. Step 2. The pressure check, 5 seconds. Place your index and middle fingers, or just the middle finger, whatever is most comfortable, on the spot, and apply your ripe tomato pressure, firm but comfortable. Take a deep, slow breath. Step 3. The circular pump, 30 seconds. Using that moderate pressure, begin small, slow, circular movements. Perform the motion clockwise for 15 seconds. Visualize the movement, encouraging stagnant blood to flush out and fresh blood to flow in. Perform the motion counterclockwise for 15 seconds. This ensures you are reaching all the surrounding muscular fibers and nerve endings. Step 4. The press and hold decompression, 20 seconds. Switch to a press and release pattern. Apply firm pressure, holding for a slow count of 5, and then fully release for a slow count of 5. Repeat 2 to 3 times. This focused, sustained pressure is invaluable for nerve release, helping to decompress the trapped pudendal nerve branches. Muscle release, targeting specific trigger points, knots, that have built up in the deep pelvic floor muscles. Step 5. The deep breath finish, 5 seconds. Remove your fingers and take one final, deep, slow breath, inhaling into your belly, diaphragm, and exhaling completely. This reinforces the parasympathetic state. The optimized oil protocol, more than just lube. The oil is your therapeutic medium. I recommend starting with one of these 3 options to maximize the benefits. Option A, castor oil, the deep tissue penetrator. Why it works. Biologically, castor oil contains over 80% ricinoleic acid, a powerful, unique, anti-inflammatory fatty acid that has an unparalleled ability to penetrate deep fascial layers. When applied topically, it has been shown to improve localized blood flow and reduce the type of deep inflammation that causes tissue stiffness and vascular constriction. The practical advantage: it gives you a therapeutic depth that lighter oils cannot match. Use a high-quality, cold-pressed, hexane-free organic castor oil. Option B, black seed oil, the hormonal and circulatory booster. Why it works biologically. Black seed oil, Nigella sativa, is a powerhouse of compounds, most notably thymoquinone. Studies have linked black seed oil to improved blood flow